तो पहले तो ये इस बात से शुरू करेंगे कि वेट लॉस किसको करना है और क्यों करना है। उसका मतलब ये है कि पहला क्वेश्चन ये एड्रेस करना है कि ओबेसिटी क्या है या मोटापा क्या है। और कौन से हद के ऊपर जब मोटापा चला जाता है, और व्हेन ओबेसिटी गोज टू अ सर्टेन लिमिट which rings an alarm bell in your body, what is that point? So ग्लोबली जो पॉपुलेशन है, अलग अलग टाइप के जेनेटिक्स होते हैं। इंडियन बोलो, एशियन पॉपुलेशन, अफ्रीकन, यूरोपियंस, अमेरिकन, साउथ अमेरिकन, नॉर्थ अमेरिकन, सो दीज आर ऑल डिफरेंट टाइप्स ऑफ पीपल, and everybody has a different form of culture, lifestyle, eating habits, and so obesity is also defined and classified according to the genetics of a population and the cultural way of living of those people. In India, which is a part of Asia, we have a consensus guideline which says that anybody who is above a body mass index of 27 kilogram per meter square is considered as an overweight individual. Anybody who is above a BMI of 32 kilogram per meter square but less than 37 kilogram per meter square is considered to be a morbidly obese person, or a class 1, falls in class 1 obesity. And anybody who's above that, class 2 actually also is included in that. Anybody who's above that is going to be considered as a proper morbidly obese person. And as you keep going up, the classes of obesity are defined as class 1, class 2, class 3, and class 4 obesity. So normally मेरी प्रैक्टिस में जब कोई पेशेंट आता है मेरे पास कि भाई मेरे को मोटापे से प्रॉब्लम है या मुझे ओबेसिटी की वजह से तकलीफ हो रही है, तो देयर आर लॉट ऑफ थिंग्स इन्वॉल्व इन दैट, एंड आई हैव टू स्क्रीन एवरी इंडिविजुअल इन ट्राइंग टू फिगर आउट what is the particular need of that particular person, and what kind of weight loss can I offer this person, and in what form of weight loss can I offer it, whether it is surgical or non-surgical. बिकॉज आप जब हमारे पास आते हैं क्लिनिक में, सबसे पहला सवाल आपके मन में, नॉर्मली इंसान के मन में ये होता है कि नहीं, सर्जरी करानी पड़ेगी क्या, बिना सर्जरी के नहीं हो सकता है। करेक्ट मी इफ आई एम रॉन्ग, बट दिस इज नॉर्मली द फर्स्ट क्वेश्चन दैट कम्स टू मोस्ट पीपल्स माइंड्स। ठीक है। सो anybody who is above a body mass index of 37 kg per meter square in India, in an Indian population, is considered morbidly obese and is a candidate for a weight loss procedure, which normally when I say weight loss procedure, it means surgical weight loss procedure, जिस जो हम लोग दूरबीन शस्त्रक्रिया से, लैप्रोस्कोपी से या रोबोटिक से करते हैं। जब इन वी रिड्यूस द साइज ऑफ द स्टमक, इंसान का जो पेट होता है अंदर, जठर बोलते हैं जिसको, उसको छोटा कर देते हैं साइज में, और उसकी वजह से वेट लॉस होने लगता है। सो एनीबडी हु इज मोर देन 37 kg per meter square is the most ideal candidate for a weight loss surgical procedure. अब आता है वो पॉपुलेशन जो 37 और 32 के बीच में है, तो ये बॉर्डर पे है, मतलब इनके लिए ऐसा है कि भाई सर्जरी करने की जरूरत हो भी सकती है, नहीं भी हो सकती है, लेकिन उसमें भी क्राइटेरिया है। सो एनीबडी who is in this 32 and 37 bracket but is suffering from type 2 diabetes, जिनको डायबिटीज है, जो डायबिटीज के लिए गोली लेते हैं या इंसुलिन लेते हैं, कुछ सालों से ले रहे हैं या हाल ही में डिटेक्ट हुआ है, जिनको ब्लड प्रेशर है, कोलेस्ट्रॉल के इश्यूज हैं, हार्ट डिजीज हो, या किडनी खराब हो रही है धीरे धीरे, या ऐसे सब जो इश्यूज है, नी जॉइंट में ऑस्टियोआर्थराइटिस है, चलने में तक दिक्कत हो रही है, किसी ने बोला है कि भाई नी रिप्लेसमेंट कराना पड़ेगा, बुजुर्ग हैं जो 60 साल से ज्यादा उम्र के हैं, 60 और 70 के बीच में हैं, घुटने काम नहीं कर रहे हैं, वजन बहुत ज्यादा हो रहा है, चल चल नहीं पा रहे हैं, और बोला गया है कि हाँ भाई आज नहीं तो कल अपने को नी रिप्लेसमेंट करना पड़ेगा। दीज आर पीपल, any one condition with a BMI of 32 and 37, between a BMI of 32 and 37, are also eligible and will do very well with a weight loss surgery procedure. तो अभी बचता कौन है? 27 और 32 के बीच वाले जो बीएमआई के पेशेंट्स हैं, जिनका बॉडी मास इंडेक्स, बीएमआई कैसे कैलकुलेट करते हैं, मेरे ख्याल में सबको पता होगा कि बीएमआई जो है वो बॉडी मास इंडेक्स है, वेट इन किलोग्राम डिवाइडेड बाय हाइट इन मीटर स्क्वायर, मतलब अगर आपकी हाइट 1.7 मीटर्स है या 170 सेंटीमीटर्स है और आपका वेट 100 किलो है, तो इट इज 100 डिवाइडेड बाय 1.7 मल्टीप्लाइड बाय 1.7, तो 1.7 स्क्वायर. ओके, सो दैट इज व्हाट इज बेसिकली हाउ यू कैलकुलेट बीएमआई. अगर आप इंटरनेट पे जाएं, आप स्मार्टफोन यूज करते हैं, तो आप सीधा गूगल पर जाके अपना, उसमें बहुत सारे फॉर्मूलाज अवेलेबल हैं, आपको सिर्फ अपनी वेट को डालना है और हाइट को डालना है और ऑटोमेटिकली वो कैलकुलेट करके बता देता है. आपको गणित जोड़ने की भी जरूरत नहीं, कैलकुलेटर पे जाने की भी जरूरत. तो एक बार आपको पता चल जाता है कि हाँ भाई, ये मेरा वजन है, ये मेरा बीएमआई है, तो मैं कौन से कैटेगरी में हूँ. अभी डॉक्टर जयदीप ने जो 3 कैटेगरीज बताए, उनमें से मैं किस में फिट होती हूँ या होता हूँ. तो नाउ द कैटेगरी विच आई एम टॉकिंग अबाउट और आई एम गोइंग टू टॉक अबाउट इज बिटवीन 27 एंड 32 बीएमआई. तो ये जो है वो असली बॉर्डर लाइन कैटेगरी है, जो फेंस पे बैठे हुए हैं, जिनको, जो 32 के ऊपर भी जा सकते हैं या 27 के नीचे भी आ सकते हैं. तो अगर इनमें से लोगों को बीमारी हो, जो मेडिकल बीमारियां मैंने अभी आपको बताई हैं, तो इट्स नॉट नेसेसरी कि आपको सर्जरी के लिए जाना है. इसमें नॉन सर्जिकल प्रोसीजर भी है, जैसे हम लोग एंडोस्कोपी करके पेट के अंदर एक बलून डाल देते हैं, या एंडोस्कोपी करके पेट को छोटा कर सकते हैं, या फिर सिर्फ दवाइयां लेके या गोली लेके. आजकल हाल ही में मार्केट में काफी हलचल मची हुई है वेट लॉस ड्रग्स की वजह से. देयर इज अ वेट लॉस ड्रग which is called Rybelsus, which is now available and manufactured and marketed by Novo Nordisk, which is a pharmaceutical company which is US based. They have done a lot of research, and this particular drug, which is called semaglutide, is now available in a tablet form, available in the Indian market in 3 milligram, 7 milligram, and 14 milligram strength. And I can even prescribe that as a weight loss medication for somebody who is in this category of 27 to 32, to see if we can get your weight down to a normal BMI just with the help of these medications. But these medications have to be taken over a very, very prolonged period of time. And currently, they are quite expensive. So we have to weigh the pros and cons of every treatment, कि भाई कौन सी ट्रीटमेंट में क्या क्या करना पड़ रहा है. गोली सिर्फ खानी है, कितने टाइम खानी है, उसका खर्चा कितना होगा, उसके साइड इफेक्ट्स क्या हैं, ये सारी चीजें अपने को देखना बहुत जरूरी है. अगर एंडोस्कोपी कर रहे हैं तो उसके साइड इफेक्ट्स क्या हैं, उसकी बेनिफिट्स क्या है, बेनिफिट्स साइड इफेक्ट से ज्यादा है, वेट लॉस कितना इफेक्टिव है, गोली से बेहतर वेट लॉस है या गोली से कमजोर है वेट लॉस, सर्जरी करनी है तो वेट लॉस कैसा होने वाला है, कितना होने वाला है, वेदर इट इज गोइंग टू ब्रिंग मी डाउन टू माय आइडियल बॉडी वेट और नॉट, उसका खर्चा कितना है, उसके साइड इफेक्ट्स क्या है. तो ये सारी चीजों को अपने को नाप तोल के फिर डिसीजन लेना है. अगर कोई मेरे पास आता है, बोलता है कि मैं 150 किलो का हूँ और मुझे आप सिर्फ गोली दो, मैं सर्जरी नहीं करा सकता हूँ, मेरे को करानी ही नहीं है सर्जरी, तो वो प्रॉब्लम है. क्योंकि मैं आपको गोली दे सकता हूँ, लेकिन वो कितने महीनों, कितने साल आप लेंगे वजन घटाने के लिए, और उस गोली का लॉन्ग टर्म में क्या साइड इफेक्ट होने वाला है वो आपको पता नहीं है. तो इसकी वजह से ये इलॉजिकल हो जाता है कि भाई 150 किलो का इंसान मेरे सामने बैठा है और वो मुझे बोल रहा है कि नहीं, मेरे को सर्जरी नहीं करानी है, ना ही मेरे को एंडोस्कोपी करानी है, मुझे सिर्फ टैबलेट या इंजेक्शन फॉर्म में आप दवाई दीजिए, उससे मेरा वजन कम होना चाहिए. तो वो इनप्रैक्टिकल है. तो वैसे नहीं कर सकते हैं. ठीक है, इसलिए हर पेशेंट के लिए, हर इंसान के लिए एक कस्टमाइज्ड अप्रोच होता है. और वो कस्टमाइज अप्रोच हम तब इम्प्लीमेंट कर सकते हैं जब आप मेरे सामने आके बैठेंगे, मैं आपसे बात करूंगा, आपकी लाइफस्टाइल के बारे में समझूंगा, आपकी मेडिकल प्रॉब्लम्स के बारे में समझूंगा, और उसके बाद डिस्कस करके आपको ऑफर कर सकते हैं कि हाँ भाई, ये ABCD वजह से मैं आपको या 1 या 2 या 3 ऑफर कर सकता हूँ, और उसकी वजह ये है. ठीक है ना. तो एसेंशियली दिस इज व्हाट is how we decide as a bariatric surgeon. This is how I decide how to take care of obesity in a person who comes to my clinic. कि भाई इसके लिए हमको क्या करना है और क्या कर सकते हैं. इसमें बहुत और भी चीजें इन्वॉल्व है, जैसे कि आपके फैमिली में कौन लोग हैं, आपको घर में सपोर्ट कितना है, आपको कोई है प्रोसीजर के बाद हेल्प करने वाला है, या कोई दवाइयाँ खाएंगे, गोली खाएंगे वेट लॉस के लिए, तो उसकी वजह से कुछ साइड इफेक्ट होने वाला है, तो वो घर में कोई हेल्प करने के लिए है, उसमें उसके बारे में समझने के लिए है कि नहीं. एसेंशियली व्हाट आई एम ट्राइंग टू से इज दैट friends and family around you is very important when you're trying to deal with obesity and weight loss. So that is one of the most crucial things, because जब इंसान बहुत ज्यादा मोटा हो जाता है या मोटापे से त्रस्त हो जाता है, तो उसको मनोवैज्ञानिक दबाव भी बहुत आता है. देयर इज अ लॉट ऑफ मेंटल प्रेशर which comes on these people who are suffering from obesity. So I have seen that in my profession. मैं अभी 20 साल से देख रहा हूँ कि lot of people go into depression, lot of people have anxiety issues, वो lot of people become socially outcast because people don't want to hang around with somebody who is morbidly obese. People अपने जो दोस्त हैं, अपने रिश्तेदार हैं, वो ही अपने को अवॉइड करना चाहते हैं क्योंकि हमारा रूप उनको पसंद नहीं है या हमारा वेट इतना ज्यादा है कि उनको ये पसंद नहीं है कि भाई बाहर 4 लोगों के सामने आपके साथ मैं दिख जाऊं, तो वो मुझे पसंद नहीं है। तो ये सारे इश्यूज आते हैं ओबेसिटी में। तो इट्स अ सोशल प्रॉब्लम ऑल्सो मोर देन बीइंग जस्ट अ फिजिकल प्रॉब्लम। it's also a psychosocial problem. So we have to address all these issues when I am addressing a patient. So जब आप मेरे सामने आके बैठते हैं कंसल्टिंग के लिए, तो ये सारी चीजों को देखा जाता है और उसके बाद ये डिसाइड करने में आता है कि भाई आपके लिए क्या सही है। तो आपको कुछ सवाल पूछने हैं मुझे अभी, या मैं आपको कुछ फोटोग्राफ्स दिखाऊं जिसमें कौन से प्रोसीजर्स हम करते हैं, जिससे आपको एक आइडिया है कि मैं करता क्या हूँ वेट लॉस के लिए लोगों के लिए। Carmen, can you open the floor for the audience, or how do we interact?
Yes, so they can they can put their questions in the Q&A box,
नहीं,
or
किसी
they can
ने
also give their comments in the chat.
sorry?
They can also give their comments or
Yeah,
questions
I
in
think
the
let
chat
them give
box.
comment because nobody's
Yeah.
written a question, so I would rather that
Yeah.
somebody talks.
They can also unmute.
आप जितने भी लोग अभी यहाँ पर मौजूद हैं, you can unmute yourself and say something if you like to, or you can ask me whatever questions you want to. Feel free. अपने आप अपना सिर्फ नाम बता सकते हैं तो नाम बता दीजिए, उम्र बता दीजिए, and then you can ask me whatever question you have. I'll be most happy to address anything, any doubt, any difficulty.
Yeah.
We have 18 people here, and I will be most happy if anybody wants to. I'm just going to share my screen in the meantime. Are you able to see my screen?
Yes, sir.
Yeah?
Yes, sir. It's visible.
So I'm just going to show some pictures, and अगर आप में से किसी को भी कोई भी सवाल पूछना हो, you please feel free. माइक खुला है, अपने आप को अनम्यूट कर दीजिए और प्लीज बात कीजिए। These are just some pictures of things that I offer to patients. प्लीज हिचकिचाइए मत, अब सवाल पूछिए। किसी ने सवाल पूछा है, ठीक है। व्हाट आर द मेडिकल एलिमेंट लाइकली टू अफेक्ट अ पर्सन ऑफ बीएमआई इन द रेंज ऑफ 27 to 32? तो ये बहुत ही अच्छा सवाल है। तो अभी पिछले 20 साल में जो मैंने मेरे प्रैक्टिस में देखा है कि 27 और 32 का जो बीएमआई रेंज है, जैसे मैंने बोला आपको, ये बॉर्डर लाइन एरिया, ज्यादातर इंडियंस को इसमें डायबिटीज हो सकती है। once you cross the BMI of 27, you may become a pre-diabetic. आप अगर एनुअल हेल्थ चेक कराते हैं तो आपका HbA1c अगर देखेंगे और वो 6 से ऊपर जा रहा है, 6.5 से ऊपर जा रहा है, तो it is very likely that if you have a family history of diabetes, you may become a diabetic. Now, the beauty of undergoing a bariatric surgery or a weight loss surgery is that it reverses your diabetes. It has been proven very adequately over the last 15 years that these surgeries performed on patients have reversed their diabetes completely. मतलब मेरे पास इतने सारे patients हैं, hundreds of patients who have benefited from this, who used to take insulin, who used to take tablets for control of sugar, have stopped everything. For more than 10 years, 12 years, people are diabetes free. So that is one of the biggest advantages. Then you have problems like knee joint arthritis, especially if you're in the elderly age group. अगर आप 55-60 के ऊपर हैं और आपका BMI 32, 31, 32 है, तो आपकी जो नी जॉइंट है जो लिगामेंट्स हैं, जो उसका सरफेस है नी पे बोन्स का, वो खराब होने लगता है, जल्दी खराब हो जाता है। तो आपको ये प्रॉब्लम आने की संभावना बहुत ज्यादा है कि आपको नी रिप्लेसमेंट की जरूरत पड़े। फिर द इंसिडेंस ऑफ कार्डियक इलनेसेस, द इंसिडेंस ऑफ कैंसर, ये देखा गया है हमारे मेडिकल लिटरेचर में ऑल्सो, इट इज रिटन देयर, anybody who is overweight and obese has a 17 to 18% chance of increased incidence of catching a cancer or becoming positive for a cancer in organs like breast, uterus, colon, uh, kidney and liver। ये सारे organs में कैंसर होने की संभावना 17 से 18% बढ़ जाती है जस्ट बिकॉज ऑफ ओबेसिटी। इसके बाद एक और सवाल पूछा है किसी ने कि कॉस्टिंग क्या होती है बेरिएट्रिक की। अब बेरिएट्रिक में बहुत सारे प्रोसीजर्स आ गए हैं, और इसमें ऐसा है कि ये एवरेज कॉस्ट जो है बेरिएट्रिक सर्जरी का, जैसे स्लीव गैस्ट्रेक्टमी करनी हो या गैस्ट्रिक बाईपास करना हो, तो रफली आज की तारीख में बॉम्बे में एक 3.5 4 लाख के करीब इसकी कॉस्ट जाती है लैप्रोस्कोपी के द्वारा। अगर वही चीज हम रोबोटिक्स में करें तो भी आजकल उतना ही कॉस्ट हो रहा है। एंड टुडे इंश्योरेंस इज अप्रूविंग बोथ द फॉर्म्स ऑफ सर्जरी, इंश्योरेंस इज ऑल्सो अप्रूविंग ऑल बेरिएट्रिक सर्जरीज। सो उसमें भी कोई प्रॉब्लम नहीं है, किसी का भी मेडिक्लेम अगर 3 साल से पुराना हो तो bariatric surgery is already covered, and all insurance companies have compulsory to offer cashless mediclaim today. And for some reason, if they are not able to give them cashless because the hospital के साथ tie up नहीं है या कुछ ऐसा प्रॉब्लम हो, तो उनको reimburse करना जरूरी है। तो ये एक लॉ है अपने देश में कि बेरियाट्रिक सर्जरी कॉस्मेटिक सर्जरी नहीं है, वेट लॉस सर्जरी कॉस्मेटिक सर्जरी नहीं है, इट इज नॉट लाइपोसक्शन, इट इज नॉट बॉडी कंटोरिंग, इट इज अ मेटाबॉलिक प्रोसीजर जिससे इंसान की जिंदगी में बहुत सारा फेरबदल आ सकता है। बहुत सारी बीमारियां जैसे डायबिटीज है, ब्लड प्रेशर है, कोलेस्ट्रॉल है, ये सारी चीजें ठीक हो जाती हैं उसकी वजह से। एक और सवाल अभी पूछा है, डज अ पर्सन हु हैज अंडरगॉन बेरियाट्रिक सर्जरी नीड टू लीड अ रेस्ट्रिक्टेड लाइफस्टाइल? इसका आंसर बहुत ही सिंपल है। A person who has undergone bariatric surgery does not have to lead a restricted lifestyle but has to lead a healthy lifestyle, because your lifestyle originally was never healthy is the reason why you have become morbidly obese in the first place। मतलब अगर अपना हर चीज नियंत्रित हो, खाना नियंत्रित हो, पीना नियंत्रित हो, या रोज थोड़ा एक्सरसाइज करें एक मॉडरेट अमाउंट में 30 से 40 मिनट का, तो ये एक कंट्रोल्ड लाइफस्टाइल है टू कीप योर सेल्फ फिट एंड हेल्दी। अगर आप ये सारी चीजें नहीं करते हैं पहले से और उसकी वजह से आपका वजन बढ़ गया है, बिकॉज आई एम प्रोन टू ईटिंग जंक फूड, बिकॉज आई एम प्रोन टू ईटिंग ऑयली फूड, बिकॉज आई एम प्रोन टू ईटिंग whatever food comes in front of me, because I like food, because I am a foodie, और आई हैव अ स्वीट टूथ कि मैं जब चाहिए मुझे स्वीट सामने दिख जाए तो मैं उसको कंट्रोल नहीं कर सकता हूँ, अपनी अर्ज को और मैं खा लेता हूँ। ये सारी चीजें बंद करनी है। इसका मतलब क्या है कि आप खा सब कुछ सकते हैं, पर एक नियमित मात्रा में खा सकते हैं। एनीथिंग दैट इज कंट्रोल्ड इज गुड। So if you're a smoker, it's not good, because smoking directly affects your lungs and it can cause cancer. Similarly, if you have extra food, it is going to cause problems. It is going to cause obesity. So as children, our parents used to always tell us, स्कूल में जाने से रहे जब पेट भर के खाना खाओ तो शरीर में ताकत रहेगी, पूरा दिन का काम निकलने। पर इसका ये मतलब नहीं है ओवर ईट। ये उन्होंने कभी नहीं बोला कि जरूरत से ज्यादा खाओ। सो दैट इज द मीनिंग ऑफ a controlled lifestyle. It doesn't mean that you have to restrict your lifestyle. You can eat everything. You can even have probably your share of one drink at a party or in a social gathering. I hope that answers your question. किसी और को कोई और सवाल पूछना हो तो प्लीज बेझिझक पूछिए, ये आपका मौका है। मैं सामने बैठा हूँ। इट्स लाइक अ कंसल्ट। ओके, देयर इज अनदर क्वेश्चन। There are two more questions. What are the side effects of bariatric surgery? What care has to be taken after bariatric surgery? How many days rest is required after bariatric surgery? ठीक है। तो बेरियाट्रिक सर्जरी के आज की तारीख में कोई साइड इफेक्ट्स नहीं है। द ओनली साइड इफेक्ट विच यू if you say that it is a side effect, is you're not able to eat like the way you used to eat before the surgery. Because जब मैं आपका स्टमक छोटा कर देता हूँ साइज में, तो अगर बैग जैसा पेट है जिसकी कैपेसिटी 2 लीटर है, इफ इट इज 2 liters इन कैपेसिटी योर स्टमक वॉल्यूम, एंड आई रिड्यूस इट टू 100 ml, then you can only fit in 3 or 4 morsels of food. Once you fit in that much, you're full. If you try to eat an extra morsel, you will get nausea. If you try to eat over that, you will throw up. So that is the only side effect of bariatric surgery as of today, that you will feel nauseated or vomit in case you consume more than required food. Okay. The care of bariatric surgery, aftercare of bariatric surgery, is hardly anything. It's like undergoing a hernia surgery or a gallbladder removal surgery or an appendix surgery done with laparoscopy, or in women, some women have to undergo removal of the uterus or hysterectomy, or a removal of fibroids in the name of myomectomy. So the incisions are very tiny. Today when I offer robotic surgery to patients, 8 millimeter के छोटे 4 cuts होते हैं, उसमें पूरी की पूरी surgery हो जाती है. 24 घंटे बाद, after 24 hours, you won't even feel like you've undergone a surgery. So that is how sophisticated the infrastructure and technology and surgical skills are today, that you won't even feel that in 48 hours you'll forget that you had a surgery. Normally, I expect my patients to go back to work if they're traveling to office every day at the end of 4 days of surgery. So 2 days you're in the hospital, 2 days rest at home, and the next day you can go. So over a weekend, if you get operated on a Thursday, Friday, 2 days rest at home, Saturday, Sunday, Monday you should be back in office. And if you're working from home, then there's no problem. You go home and you start working, there won't be any problem. Okay. So that's the amount of rest that you need to take. Normally, I make patients walk 6 hours after surgery. We normally don't even catheterize patients for passing of urine. We encourage them to go to the toilet and pass urine. The next question is, can a person again become obese after surgery? Yes, a person can become obese after surgery. Statistically, it is seen that if 100 patients undergo a bariatric surgery or a weight loss procedure, whether it is endoscopic, whether it is laparoscopic or robotic, 15 to 20 of those patients are going to regain weight because their lifestyle was not healthy even after the surgery. So you lose weight. अगर आप 120 किलो के थे and you come down to your almost your normal body weight for your height, which is say 60-65 kilos, and you plateau there, you will maintain that weight for maybe 1 year, 2 years, 3 years, and then you again go back to your old habits of not exercising, eating unhealthy food, eating junk food. The same stomach which I had reduced in size is going to stretch again because the stomach is elastic. The muscle of the wall of the stomach is elastic and can stretch. So 15 to 20% of the patients can regain weight, which means that 75 to 80% of patients maintain their weight in the long term for 15 years, 20 years, even after bariatric surgery. So you have to decide in your head whether you want to be part of the 75 to 80% or you want to be part of the 15 to 20% who regain weight. Okay. What is the minimum weight to get this surgery? That's the next question. What is the minimum weight to get this surgery? And post this surgery, what are the limitations of activities restricted? So there is no minimum weight which is given for this surgery. The minimum prescribed BMI or body mass index in Asian patients or Indian patients is 32 that is required. Anybody who is less than 32 but more than 27 has to have uncontrolled type 2 diabetes, which is not coming under control even after giving high doses of insulin, and the physician or diabetologist or endocrinologist has tried more than a year but is still not able to control your diabetes, then you are eligible even if your BMI is less than 32 but more than 37. But anybody above a BMI of 32 technically is a candidate for weight loss procedure and will get insurance provided the documentation is correct, provided you have given the right details to the insurance company when you have taken the mediclaim. And anybody who is above a BMI of 35 is straightforward given mediclaim for any problem with related to obesity. The next question is, can a person who has undergone intestinal obstruction and appendicitis surgery about 25 years ago undergo bariatric surgery? Yes, absolutely. You can definitely undergo bariatric surgery even after this. I have operated on many such patients who have undergone multiple surgeries in the past, including cardiac bypass, including kidney transplant, and these patients have successfully undergone bariatric surgery. The only thing is it requires highly experienced and a skilled surgeon to take care of the bariatric surgery because it is in the same abdominal cavity. So the question you have asked here is a very good question, Mr. Matthews, because the abdomen is the place where the intestinal obstruction has also happened and the appendix has also been removed, but that's in the lower part of the abdomen on the right side. We are going to operate on the stomach, which is in the upper, central, and left side. So the surgery definitely will be a slightly difficult one than in a person who has never undergone any surgery inside the abdomen. But with my experience of more than 2 decades now, I don't think that should be a problem at all. So again, the next question is, this covered under medical insurance? I have already said this. It is covered under insurance for the last 3 years. It is compulsory for any mediclaim insurance company who is offering mediclaim to Indian citizens that they have to give insurance for bariatric surgery because it is not a cosmetic surgery, and you have to have a policy where you have been paying a premium for the longest time, and it has to be a minimum of more than 3 years that you have had this policy, and you have declared all comorbidities. Matlab, if you have had any illnesses in the past, like diabetes कितने साल से है, blood pressure कितने साल से है, और कोई सर्जरी हुई है कि नहीं हुई है इससे पहले, all these things have to be truthfully declared to mediclaim or to the insurance company, and you will definitely get mediclaim. Most of my patients who have undergone surgery in the last almost 15 years have claimed for insurance, and majority of them have got it. The rule for mediclaim to be given for bariatric surgery has been approved only 3 years back, but recently in the last month itself, two of my patients have got insurance for surgery, bariatric surgery, which I had performed on them 10 years back, because they went to consumer court and they fought the case, and the insurance company had to pay them with interest because the consumer court ruling went in their favor, and they had to pay the insurance company. And this is New India Assurance, which is the largest insurer in health sector in our country, had to pay with interest to my patient, and my patient got more than, I think, 6.5 lakhs because of the interest accumulated over 10 years for a claim of three and a half, I think 3.5 lakh back then. 3,25,000 was their bill. So I hope that answers your question. If you have a company group medical insurance, yes. In fact, if you have a corporate insurance, then it is given 100%. If you have an individual insurance, then there are problems to tackle, and we have to go back and forth. Sometimes I have to give them justifications as a doctor, as a treating doctor. I have to give them justification. But if you are a corporate insured person, then there are no questions asked, because they cannot, insurance companies cannot risk a corporate claim being rejected, because they may not get the premium, or they may, the corporate company may discontinue the plan with that particular insurance company the following year if their approvals are not up to the mark of the company that you are working for. Then they may discontinue this particular company and hire another services of another insurer. So definitely corporate insured patients have a much better uh, chance of getting, or not even a chance, they always get it. So I think I've answered all possible questions. If you have even more questions, feel free to shoot them. Any question, and I'll be most happy to take them. So at Hinduja, Mahim and Khar, between Mahim and Khar, we are able to offer both laparoscopy and robotics, and very, very attractive packages for both laparoscopy and robotics. And like I said, insurance is covering everything. So at Mahim Hinduja, we have the most state-of-the-art Da Vinci XI robot, which I use for my surgeries, and that's uh, the infrastructure there, the operating room there, the OR table, everything is very, very sophisticated, and you won't find it in the rest of the country. That's for robotic surgery. And at Hinduja Khar, we have probably the best nursing care. And if any one of you who has been patient at the PD Hinduja Hospital at Khar will know for sure and will agree with me that a patient goes home happy from Hinduja Khar, because I personally feel that the nursing care, the team in the operating room is really fabulous, and they really work hard to make sure that our patients are happy and they go home with a smile. So I don't think you would have any doubts. All those people who have joined and who have experienced uh, whatever healthcare they have gone for at the PD Hinduja Hospital in Khar, you would vouch for the same that I am just saying right now. If you have any further questions, please feel free. Okay, what risk on table while doing the surgery? So there is absolutely no risk on table while doing the surgery. A patient is screened very, very thoroughly before surgery to make sure that there is no risk during the surgery. And if somebody is medically unfit to undergo general anesthesia, which is required for this surgery, we will tell you upfront that, okay, you are not a candidate for surgery because we can't give you safe anesthesia. So we can't do the surgery. But other than that, there is no risk of life in a bariatric surgery at all. For the longest time, bariatric surgery has been one of the safest surgeries. It has the one of the best safety profiles. So if you go to Google and search on safety profiles of planned surgeries, bariatric surgery is even safer than removing a gallbladder for gallbladder stones or removing the uterus for any problems laparoscopically or robotically. So, bariatric surgery is a very, 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 very safe surgery. Please have no two doubts about that in your mind. The very fact that I can send you home in 24 to 36 hours after surgery means that bariatric surgery is a safe surgery and you have no risk of life on table, for sure. Cost of surgery. So again, the cost of surgery, I already mentioned, minimum cost of this surgery is roughly around 3.5 lakhs to 4 lakhs, and it goes up depending on the type of room you take. But all budgets can be taken care of. There are if you are a person who is not financially really sound, we can also perform the procedure in a weaker section for you, provided you have the right paperwork and documentation to show that you belong to an economically weaker section. So pretty much every section of the society can be taken care of. So please don't worry about the cost of the surgery. All you have to do is approach me, and we will find the best way of trying to get the surgery done for you. But on an average, in a twin sharing room, it costs roughly between 3 and 4 lakhs. And of course, it is completely covered by insurance. Any other questions? Please be my guest. Ask. Feel free to shoot any question. What is the life expectancy after? So the life expectancy has got nothing to do with bariatric surgery. Your life expectancy is going to be your life expectancy that it was, but it will definitely increase it. It won't decrease it. That's a certainty that bariatric surgery increases your life expectancy, because if a person is morbidly obese, his BMI is 45, he's going to have all sorts of problems that you cannot even think of medically, and you're going to have repeated hospitalizations. So in that sense, your life expectancy is going to be smaller. But if I treat you for your morbid obesity and you become a normal weight person for your height, it is only going to increase your life expectancy. It is not going to decrease it for sure. So bariatric surgery today is categorized as a life-saving procedure. Okay, make no mistake about it. So if a person undergoes a bariatric surgery, you are going to push away cataract surgery. You're going to push away chronic kidney disease and maybe dialysis somewhere down the line if you have a potential of reaching there. You're going to push away knee replacements and hip replacements. You're going to push away angioplasty and cardiac bypass. So all these things are going to be pushed away further in your life if you take care of your weight, if you take care of your obesity. And that will be because of the bariatric surgery. Any other questions? Please feel free. So Sunil has a question. 5 feet 7, 170 centimeters, and 120 is your weight. So then it means that your BMI is 41.5. Post this surgery, how much time does it take to come to normal weight? You're going to take barely 6 to 8 months to come down to a weight which is almost normal for your height. So your excess weight in this particular case of 5'7" with 120 kilos weight is roughly around 55 to 60 kilos. You're going to lose around 50 kilos of that, 45 to 50 kilos of that in 8 months, tops 10 months. In 1 year, your weight plateaus. So the total weight loss happens in the 6 to 8 months after surgery. Any other questions? Please feel free. There are a lot of participants today, and I'm very happy that so many people have taken out time today to attend this program, which has been hosted by PD Hinduja Hospital Khar. And I'm really glad that on a weekend, there are so many people who are conscious and want to address their issues with respect to obesity. Somebody's raised their hand. Is there a question? Yeah, there is a question. You can ask me the question, madam. You can ask me on the mic or you can type it down. Whatever the question is, you raised your hand. Yeah, please feel free to speak. Unmute yourself and speak.
Hello.
Yes, madam, we can hear you.
Whether pregnancy is possible after this surgery?
Yes, 100%. So we normally offer this surgery and explain to the patient that, because I just mentioned the answer to the previous question, that what is the time period of that weight loss. So the weight loss happens in the first 6 to 8 months and then gradually plateaus. And the weight loss process of the surgery or the effect of the surgery is over by the end of 1 year. And that is when we ask a lady to try to conceive for a pregnancy. So you have to wait for 1 year from
Okay.
the time of bariatric surgery. And a lot of our patients are referred to us by gynecologists and obstetricians for infertility, because morbid obesity can cause primary or secondary infertility in women. And these people are referred to us by their gynecologists. So we
Okay.
operate on them, we perform the bariatric surgery, the weight comes back to normal, the hormones which are been disrupted, the reproductive hormones which get disturbed by because of obesity come back to normal, and most of these women conceive naturally and they don't even require artificial methods of reproduction like IVF, and they conceive normally, and then they can have a healthy child. Okay. So there's no problem having a pregnancy.
Okay. But this after the surgery, like how long bed rest or like for a working person, working lady rather, how long to stay at home?
So I already answered this question earlier, but I will tell you once again that I
Please.
expect and discharge a patient from the hospital in 48 hours usually. A person
Okay.
who wants to, a person who's a working person is obviously otherwise a fit and able person and who's an active person going to work every day. Another 2 days of rest at home maximum, and you can go back to work. You can even travel in a local train or in a taxi or drive your own car and go. And there should not be any problem because you won't feel that you've undergone a surgery. You won't have that pain or anything. Even the elderly people, at the most, it takes them 4 or 5 days after discharge to come back on their own and do all their normal routine activities like nothing ever happened to them.
Okay. But sagging of face and all that, like it will not have any.
So it depends on how big you were to begin with. Okay. So
Okay.
if a person is 55 BMI versus a person who was 35 BMI,
Hmm.
also depends on how old you are. The older you are, the more sagging you are going to get. The younger you are, the less sagging you're going to get. The bigger you are, the more sagging you're going to get. The younger you are, the less sagging you're going to get. These are properties of skin of a human being. Okay. So as we
Okay.
grow old, we get wrinkles on our face. That's because we lose elasticity.
Hmm.
Obesity stretches the skin to the maximum. And then suddenly, when all that fat gets absorbed by the body after a bariatric surgery, that skin is going to overhang. Okay. So the more
Yeah.
obese a person is to begin with before the surgery, the more chances of that person sagging. But the more you exercise after surgery, it lessens the amount of sagging. So I tell all my patients very categorically that you have come to me because you want to become fit, you want to look good. So after surgery, you have to start exercising. You have to be very, very regular and go back to the gym or hit the playground or do something to stay physically fit. And that will also take care of the sagging. Okay?
Okay. Thank you so much.
Most welcome.
Thanks.
Any other questions, please? Is there another question in the question box? Yeah, okay. Okay. So there's a question that is 3.5 to 4 lakh is the basic cost, I suppose. How much can it stretch to the maximum? Up to what age can you do this surgery? All right. So there are fixed packages that we have made at Hinduja Khar and at Mahim Hinduja. And that is end-to-end cost. It covers everything. Unless something goes wrong, unless there is a complication which was not foreseen, this never changes. The package is end to end most of the times. If you take a deluxe room or a suite or something, then the package can go to 8 lakhs, 10 lakhs, 12 lakhs, whatever. Because you have chosen that. It's like flying in a business class or a first class in an aircraft. You can go economy class, and in economy also there are different categories. But if you're traveling first class, then the cost can be anything. As far as the age is concerned, the youngest is around 15 years for a girl who has attained menarche and has regular menstrual cycles. 18 years for boys because they finish their bone growth later than the girls. And at the other end of the spectrum, in the elderly population, we can operate up to 75 provided they have not too many problems with respect to their heart and breathing and lungs and everything, which normally we assess before surgery by doing a whole bunch of investigations. And me and my anesthetist will certify that okay, this person is fit or not fit to undergo general anesthesia for a procedure which usually lasts 3 to 4 hours. So highest age that I have operated on so far is 78, but the person was otherwise absolutely fit and he's still doing well. So that should answer the question. What are the exercises to be done post-surgery? The exercises done post-surgery can be in the form of cardio and muscle training or weight training. And it depends on how big you were to begin with and how you lose your weight. But it has to start with something as basic as walking, going to brisk walk, going to jog, swimming if you can, do intense yoga. Start with gradual yoga, then do hike the yoga up, and then do intense yoga. Go to the gym, do some weight training, lift some weights, get an instructor to teach you how to do certain things. You can do floor exercises at home. So cycling, there are a lot of things that one can do. It is just that you have to keep it in your head that I want to do it. That's all that you need to take. Person suffering with constipation and who is taking daily medication for bowel movement can do this surgery? Yes, that is a very, very good question. And I'm glad somebody asked this question. It had actually slipped my mind. But a lot of people who are constipated get relieved of their constipation after the surgery, because one of the mechanisms of this surgery is that it pushes the food faster to the intestine and allows less digestion of food, and it is sent to the large intestine faster. So most people are relieved of their constipation after the surgery. So we are at the last 4 minutes of our session. If you have any other questions, feel free to shoot. And if you have anyone who is interested in coming and seeing me for a consult for their friends, relatives, family, anybody for themselves, uh, please reach out to Khar Hinduja. I am there practically every day, sometime in the first half from Monday to Friday. And even at Hinduja Mahim on Tuesdays and Thursdays in the evening for those people who are working.